Welcome to the WHHI Daily News. Dr. Debi Lynes has joined us for her Mind Your Health segment. And we're talking about healthy couples.
It's going to be a fun one today.
It's a good one, whether you're married or not, how you get along in your relationship, how it can be healthy.
You know what's really interesting when we talk about couples, it's really shifted a lot, probably in the past 20 or 30 years, and I can tell you the main reason. I always, when I meet with couples, I said this to you, we've got one for sure strategy that works for couples to improve their communication, period, across the board in today's world. And you know what that is?
It's full.
Yeah, right, exactly. Couples it's a 100% way to improve your communication, and that is put down your cell phone.
Oh, I know.
You know, it's really interesting. I had a couple that I met with right before this show, and we were talking a lot about what they could do to improve their communication, what they could do to feel more connected. And it was funny because we started talking about when they get up in the morning, they check their emails and they're on their phone and they're just doing a quick scroll and they're doing this and doing that. And they were talking about how one of their friends take the morning and the first hour and just sort of don't pick up their phones for the hour. Mine's sitting right here, just so you know, because we're... And when they started to do this and they came back after a month, they were like, oh my gosh, what a powerful way to just reconnect in a gentle way, quite frankly. But it wasn't anything planned and it didn't take a lot of effort. It just both of them agreeing that before they start on their phones.
But you said both of them agreeing.
Okay, there's the key.
So that's the key. I've noticed my husband is on his phone a lot more, and when I say something, he says, but you're on your phone a lot.
Correct.
But I'm not on my phone as much as he is these days, and so I don't want now create a problem.
Exactly. And so what that is there's no tit for tat. It's simply saying, you know, neither of us need to be anywhere until 9 o'clock.
Yeah.
And we typically get up at 7.
Yeah.
So what we're going to do is we're going to get up at 6:30 and we're going to make an agreement. We'll try it for a month if it doesn't work. And that agreement is we're not going to pick up our phones until 7:30. So that'll give us 6:30 till 7:30, and let's just chat. We don't have to do anything drastic. We can get up and go get our coffee like we normally do.
Right.
And we can just see where that takes us. And the interesting part is the couple that I worked with came back and said they were stunned because they have little people running around. The kids weren't up yet.
Yeah.
They found that it wasn't a big drama or dilemma. It was just they sort of reconnected on, you know, let's make our coffee with oat milk today, and that led to something else. And so I think sometimes we think of couples therapy or we think of better communication as this grandiose kind of intervention that we have to have, when it's really just mindfulness and paying attention and being in the moment.
Being present.
And being present. And all that means is, for a few minutes, maybe setting aside a distraction, whatever that is.
What's going to happen, Debi, in the future, like, I don't know, 20 years down the road, when we don't even have a thing, but it's like embedded, like, I know we have the whatever, but there's something embedded, and it's just like part of your body. I mean, right now, this thing is really part of it, but we can set it over here. But, you know, I just feel that it's...
You know what's funny? In the last 40 seconds that we have, I just got back from a conference on technology and youth, but it was really about technology and adults and where we're going to be in 20 years. And the hope is we're going to be exactly like we were when the black and white TV came out, where we thought the world was going to come to an end because we had the TV and this was what was going to happen. I think
we're going to go.
That's right. We're going to come to the middle.
Oh, okay. Yay.
We're going to be, because it's healthy for us. We need to use it because it's important, and we need to manage it.
Good. Well, that's very positive.
It is. I think it really is
I hope
positive.
So. Good. Well,
how's that for couples therapy 101?
Thank you, Debi Lynes, with the Mind Your Health segment. Thanks, Debi, and we'll be right back with more news.